So today we have Dr. Sarika, and she is practicing in Hyderabad. We also have the presence of Dr. Swati, and she is practicing in um, Ahmedabad, actually, Gujarat. So we're going to be talking about OAB because this is a very prominent and very important problem these days. So very welcome, ladies.
Thank you.
So the very first question would be by Dr. Sarika, and the question is, can you please describe for the patient and the audience who are watching this, what is an OAB? Because in a very layman language, if a person is having OAB, how she will get to know it?
OAB in layman language is patients having a frequency, urgency, nocturia with or without urinary incontinence. That is called OAB. So for my patients, I would like to say them, if you are avoiding more than 8 times in a day or more than 2 times in a night, or urgently you are avoiding and you are not able to hold the urine, that is called OAB. So that requires treatment for you.
Anything you would like to add?
Yeah, OAB, although like we say that it is just a physical problem wherein they have to rush to the toilet or can't hold. Many a times people don't come ahead because they feel psychologically affected. They go into depression sometimes, anxiety, self-isolation. So they should not believe that this is a part of aging and it's going to happens to all other women. But whatever symptoms Dr. Sarika just said, they should come forward and look at it that they can get relieved by treatment.
Right. Dr. Swati would like to ask you one more question, which is if a patient is having OAB, what makes it very important for a patient to make it diagnosed at an early stage and not delay the process?
Actually, overactive bladder is not like a cancer or not like a life-threatening condition, but just now that I said, it has an impact on your mind, because sometimes, like you see, the person is only thinking about washroom, when can I go, doesn't want to go out. So to make sure that you have a healthy social life and a healthy interaction everywhere, they should come ahead, because what is very important is that with medication or with treatment, it is very well controllable.
It is controllable. So, for example, when we are talking about with medication, it is controllable. So, would like to ask you, ma'am, that we have heard the term called behavioral therapy.
Yes.
How does that work and what is it?
If patient is following properly the behavioral therapy, yeah, it's a first line treatment for the overactive bladder, like fluid management, bowel management, and they can go for the drugs also. So behavioral therapy, definitely it had a role in the treatment of overactive bladder. But I would like to say that to stick on the behavioral therapy, patients are not that much educated nowadays. So they want a medical treatment also. So both hand to hand together, we can treat overactive bladder very nicely.
And would you like to add anything to behavioral therapy?
Yeah, like she said, behavioral therapy, when it's fluid management, many times patients, they don't drink because they feel if I drink water, I have to rush to the water.
Yes.
So giving up, not drinking water is going to get other problems.
Yeah.
But managing that you drink little amounts of water at frequent intervals, so that you don't drink too much at one time, or don't make that you wait till your bladder is so full that you already have a sensation and then try going, then you can't control.
Yes.
So you find out what is the gap you should normally get, go before your sensation comes in and becomes so strong that you can't hold it.
Yes.
Then there are exercises, Kegel's exercises, pelvic floor muscle training exercises, so strengthen those muscles which can help you to have a better control. So like she said, this takes time. It doesn't happen overnight. The effect takes maybe 2 months, 3 months, and we are not patient.
Yes.
Patients don't have that patience to wait. So like she said, many times what we do is we tell them all this,
Yes.
but we start them on a low dose of medication, and then we tell them that okay, if you do this well, maybe you can come off the medication and continue with behavioral.
All right. So, Dr. Swati would like to ask you that what is your advice for the individual with OAB trying to lead a healthy social life?
My advice would be that if they have this kind of complaints, don't shy away from going to a doctor. I know many women were not going because they feel uncomfortable letting a male urologist examine them. But today in India we have not enough, but many number of women in major cities, so they can find out those doctors and they can go there. Otherwise, they should visit anybody else as well, urologist, and not wait and suffer.
Right.
So that they should not go into self-isolation and psychological issues.
Dr. Sarika would like to add anything?
And the thing that they feel that it is the part of aging, so they should not aspire to go to the doctors, because we can help them to come out with their problems. Sometimes what happen in old aged patient, they have a urgent incontinence, and because of that they fell down and getting other casualties to come. So it is a treatable disease. So come forward to and meet a doctor for their problems
As soon as possible.
as soon as possible.
Well, anything which I might have missed and you would like to speak?
You have actually covered the most important
Good,
points very
points,
well.
yeah.
So the take-home message is bladder health awareness. Everyone, whether it's a male or a female, they should be aware of their bladder health. What does their urinary bladder do, and how we should take care, how we should drink good amount of water, how we should have hygiene, prevent infections, and if you have any symptoms, take timely advice and treatment. That will be the
Ma'am, anything from you?
Ditto.
Thank you, Dr. Sarika and Dr. Swati.
Thank you
Thank you
so
so
much.
much for
Thank
being
you.
here.